So, welcome everyone to the TOSIG Nutrition and Culinary Medicine program, and thank you for coming today. Today's topic is on texture and modification. So, first, a few housekeeping items. Please have your microphone silent and place yourself on mute until we enter the question and answer portion. And please direct your questions to the chat, and we will answer any questions at the end of this presentation. The goals of today's program is to help cancer patients, survivors, and their families navigate cooking during cancer treatment, to increase confidence in the kitchen, and to answer nutrition and culinary questions with evidence-based explanations. Today, we will specifically be demonstrating how to cook a healthy meal if you have difficulty chewing or swallowing. We'll begin with a brief nutrition discussion, then get into the recipes and cooking with Chef Jim. Again, please silence your microphones. We are recording the program today and want to ensure the recording is free of extra noise so that others can watch. So, just some dietitian tips. When you're healthy, eating enough food to get the nutrients and calories you need is not usually a problem. But when you're being treated for cancer, these things can be hard to do, especially if you have side effects or just don't feel well overall. Good nutrition is especially important if you have cancer because both the illness and its treatments can change the way that you eat. So, good nutrition during cancer treatment can help you feel better, keep up your energy and strength, maintain your weight and your body's store of nutrients, better tolerate treatment related side effects, lower your risk of infection, and help you to heal and recover fast. One example of an important nutrient the body needs is protein. So, we need protein for growth, to repair body tissue, and to keep our immune systems healthy. When your body doesn't get enough protein, it might break down muscle for the fuel that it needs. This may take longer to recover from an illness and can lower your resistance to infection. People with cancer often need more protein than usual. After surgery, chemo, and or radiation therapy, extra protein is usually needed to heal tissues and help fight infection. So some good sources of protein include fish, poultry, lean red meat, eggs, low-fat dairy products, nuts and nut butters, dried beans, peas and lentils, and certain soy foods. So next, we're going to kind of dive into difficulty chewing and swallowing specifically. So you might hear difficulty swallowing be referred to as dysphagia, which is the same meaning. So dysphagia means difficulty swallowing. So you might hear those interchangeably. Some cancers and their treatments may make it hard to chew or swallow foods normally. So tumors in your head or neck can obstruct certain foods or beverages. Esophageal cancer is the most common type of cancer that causes dysphagia or that difficulty swallowing, as it might narrow or tighten the passages. And radiation therapy can possibly damage tissue involved in swallowing. When it comes to difficulty chewing specifically, there are many reasons why a person might have difficulty chewing. They might have some mouth pain or mouth sores. They might have poor dentition or loose fitting dentures from weight loss, or they might just be tired and the thought of chewing is even more tiresome to them. So a textured modified or pureed diet might be recommended. So I wanted to briefly discuss the IDDSI framework, as you may be seeing or working with a speech therapist who may classify your diet as one of the categories listed above. So the IDDSI developed a global standardized way of describing foods and drinks that are safest for people with chewing or swallowing problems. So speech therapists would determine which consistency is the safest and most appropriate for you, and they will provide guidance on the foods that are allowed. So I'm not going to dive deep into this as the speech therapist. This is really their scope of practice, but just keep in mind as we're going through this presentation, if your diet has been recommended or described as one of these, it still fits into this textured modified pureed type of foods. When it comes to the speech therapy at Taussig specifically, either a provider, your doctor specifically, can place a speech therapy consult, and or speech therapists can schedule patients without a consult. They monitor the patient lists for those receiving radiation or those being discussed in certain meetings, and they can take a look at if there's needs that they can help assess. So these are just some soft food choices that us dietitians go over with patients if they are having chewing or swallowing difficulties, just in general. These are going to be softer foods that are easier to chew and or swallow. Specifically, we like to focus on the protein foods because, like I said before, protein is an important nutrient during cancer treatment. So specifically, some soft food choices would be the ones that are listed. So like chicken, egg, or tuna salad, soft cheeses, yogurt, cottage cheese, scrambled eggs, ground chopped meats, those kinds of things. And then the other items are listed below with the grains, vegetables, fruits, and desserts. So the recipes that Chef Jim will be making today are an oatmeal raisin cookie, mac and cheeseless, and squish squash. So I will now stop sharing my screen and let Chef Jim take over.
Hey, thanks, Lisa. We got an extra 5 minutes. Okay, so we're gonna start. What I'm gonna try to do is in all these recipes, show you how you can take it to different levels of texture modified diet. We're gonna start with the first one, which is squish squash. I thought, decided we do this maybe because Thanksgiving's around the corner. And this way, you could have something seasonal, because squash is in season right now. And so I want to start with the squash. It's only got 4 ingredients, which is butternut squash, apples, raisins, and OJ. And you can even leave the raisins out if you think it's too sweet. But so we'll start with we're going to use a butternut squash, but for a lot of people, this is hard to fabricate. It's hard to cut through. And even for normal people to fabricate a butternut squash. But if there is, let's say somebody did give you one as a gift or room, whatever, then ideally, you want to get one that's got a small bottom and a big top. The reason being is from here down is the seed cavity, it's hollow. So you won't get a great yield if you have a big bottom and a small top, because from here to here is solid. So the bigger the top, the smaller the bottom, the greater the yield. But you could bypass all of that and you could just buy butternut squash already in packages in the frozen section of your grocery, right? And just cook as directed on package. This one here would only take 5 minutes if you did it, brought water to simmer, because it's already been blanched before they froze it. But I checked it out, there's at least a half a dozen common brands. You can get them on Amazon, Walmart, Target, a bunch of stores sell it. And then that way you bypass all the step to fabricate a butternut squash. And then you don't even have to dice it because it comes already diced in the package. So basically, all we're gonna do, we just take our squash, we put it in a bowl with apples. Now the apples, I just want to show you a trick on this one, is that I prepped these apples about an hour and a half ago. They didn't even turn brown at all. And the reason being is because if you just take pineapple juice and you just toss them in pineapple juice, the enzyme bromelain is so powerful that it's better than acidulated liquid like lemon juice or lime juice, and it keeps these from turning brown. So that way you can get prep done way ahead of time, even for avocados or anything you're going to do like that. You're going to make guacamoles. Okay, so now the apples go in, right? Then we got some OJ, which is this one's fresh squeezed OJ, and again some raisins, okay, which is optional because it'll be plenty sweet without it. And then basically, all we're going to do is just toss it into a bowl, like so. That goes into This is I'm making a half recipe, so this is going into an 8x cooking pan, like so. Just like that. I'm gonna take it, I cover it, I put it in a 350 oven for about 70 minutes, and when I'm done, what'll happen? It'll come out. And this is what we did in a pie pan, just in case you don't have an 8x8 pan like that, right? So this one we did in a pie pan, just like so. Now I'm gonna take that. And then my bowl again, okay? Now we're gonna take that, we just put it into a bowl, and you can see the liquid coming out? Which got really thick because it has some naturally occurring sugars from the apple and the squash. And it was reducing down while it was in the oven. So now this liquid is coming out almost like a nectar, it's really good. And we're gonna take that, so if you didn't have an 8x8, you could also use a pie pan, just wanted to show you. Okay, and so then, what we're gonna do is all you need is a masher. So if anybody's got children in their life or grandchildren, they love to mash anything, it's a great thing to do with them. And so just by taking this masher, we're actually gonna do a coarse puree kind of, right? And I'm gonna show you, and I'm only doing it a little bit just now, so you can see. So you can make this chunky, or you can make it even a fine chunky like so. So I'm gonna show you different stages of this, all right? Okay. So here's gonna be the first one. We'll take some out. And you'll see what this looks like. And I'll bring this up to you. Okay. And actually, maybe I'll put all three stages in this one bowl so you could get an idea. Now, if you want it even finer, right? You could take some, put it on a cutting board. And just take it and just run a knife through it like so. Okay. And if you do that, you'll have it even finer. So I'll put a little bit of this one on this side right here. Like so. Then if you want it even finer, okay, you could take a processor like this here. So let's say you need to really puree this thing. Okay, so you could take it, scoop it into a food processor, just like that. And then now this is puree. And you'll get a fine puree on it.
Blood clots and low blood cell counts occur with optimal work.
Okay.
JAK inhibitors, serious infections, increased risk of death.
Now, we'll just take some out to show you. Okay, look, and I'll bring this up close so you can see. Okay, so now here's what we got. We got three different ways. This is just with the masher right here on top. You can see what it looks like. It's coarse, right? And then we took one and we ran a knife through it, just like so. Let me get some on my spoon here. There we go. And it's a little bit finer. And then we put it in the processor, and now it's like pudding, just like that. But what if you needed to liquefy it and do it even more? So now you could take this and add some vegetable broth or orange juice to it, and just, puree it until it gets as thin as you think you're able to tolerate, right? So you could, depending what your needs are, you can adjust that just by how much liquid you'll put in here, or at this point now, you can easily put it into a blender and really liquefy it. Okay, so that's our squash. If anybody's got any questions on any of these recipes, put them in the chat and we'll answer them at the end. Okay, so we're gonna set that one over there. And we're gonna move on to our next recipe. Okay, so the next one is gonna be our mac and cheeseless. Okay. Take this off. Right. Now, mac and cheese, okay? If you are trying to avoid all those processed cheese, okay, this is a great recipe to do, and it's pretty healthy, and it's one you can modify to really ramp up the protein as well. So we took sweet potatoes, right? And then we take them and we're gonna put them in a blender, like so. And we cook those sweet potatoes in 4 cups of unsweetened almond milk. And then it'll reduce down, and then we bring it back up to 3 cups. I'm actually doing a half recipe because I got the other half cooked, so that in this case, it's 1.5 cups. But almond milk, if you want to increase your calories, almond milk's got 30 calories a cup. But instead, if you would use soy milk, you'll get 120 calories a cup. And this is a gluten-free pasta that a half a cup has about 230 calories. But if you use 100% whole grain pasta, this has 360 calories for a half a cup. You're also getting a good amount of protein if you wanted to ramp up the protein. You get 12 grams of protein if you use soy milk versus 3 grams of protein a cup if you would use almond milk. Okay. Now, also to ramp up the protein, we took cashews, a cup that we soaked overnight, or you could also use tofu to put in there, and you'll also have a good source of protein. Salt is optional. We got little pepper, which is also optional, nutmeg, and we got a little bit of mustard that's going in here. Okay, you should have the recipes. I think they're posting them. And then, okay, this is a little bit of Cholula hot sauce. Again, this one is optional. You don't need to put it in, but it adds flavor, but totally optional for you. And then all we're gonna do is just take this. We got it in our blender. We turn it on. Okay, what happens, this comes out, yes, like a cheese sauce. So now, we got our bowl over here. Okay, this is our pasta. This one is gluten-free, just in case someone can't tolerate wheat, right? Or someone's got celiac disease. And then look like how it comes out, just like a cheese sauce. Okay, and I'll show you right here. So it comes out just like a cheese sauce. See that pour? Look at that. I'll bring it up close. I'll scoop this out. And then I'll bring it up closer and you'll be able to see. I mean, it comes out, and now, if you want to make this looser, all you gotta do is just add more either soy milk or almond milk, right? If you wanted to make it thicker, all you gotta do is just add less. Okay, we're gonna set that over there. I'm gonna bring this up, show it to you closer. Okay. And then that is gonna go into an 8x8 baking pan, but I wanna show you what it looks like. Okay. So here it is, check this out. Look at that, it comes out just like a cheese sauce. See how that pours out of there? Just like that. Now, you could use this for like a gratin potato if you wanted to, right? You could use it as a cheese sauce, like for a nacho cheese sauce. I mean, it has many applications. And there's a lot of protein in here as well, because just think if you made it with the tofu, this one was cashews. So you get a good amount of protein, okay? A 1 1/4 cup serving of this has 14 grams of protein. In 1 1/4 cups, it would have more even if you use tofu and soy milk instead of the almond. Okay, and look how creamy that looks. Okay, so now then we just take that. Okay, and we're going to put this into an 8x8 baking pan because it's a half recipe. If we'll go into a 9x13. Or if you just wanted to make a half, it would fit in that pie pan the same pie pan that we use to squish squash it, right? So we're gonna put this down here. And I'll bring it up, so look, see, and there we go. That's our mac and cheese, that goes together. And when it comes out, this is what it looks like. Okay, I'm gonna give myself some more room over here. So that there. Okay. And this back there too. Now we got some more. Okay, so now, this is what it looks like. Okay. Came out of the oven about a half hour ago. I covered it just to keep it warm. Okay, we got our dish. Right? And so now, when you scoop it out, you got this nice creamy mac and cheese. And so this is what it would be straight up, pretty soft, right? It's not, there's not much that you really gotta chew. You could almost gum this one. I mean, because it's all really soft, just like it is. But this is so easy to transform into, a mechanical soft or, different forms of a texture modified diet. So again, just put a little bit on there. Cutting board like so. Right, you could take a knife, if you don't have a processor, and just with a knife in the center. Right, just like so, now you got a coarse cut, just like this here, okay, but let's say. And even if you don't have a processor, you could just take your knife. And just by going like this here. Now you're really starting to smash it, so you can smash and chop, smash and chop. And now look at, I got a fine mince, just like you see here. And that could be one level of a texture modified diet, okay? Because you chopped it up, it's not as bulky as that one. But let's say you want to take it to another level, right? So you can do the exact same thing by putting this into that processor like so. And now you could turn this into a puree as well. So we would take that, right, just like so. Okay, we'll add some more to it. All right, and then just so you know, if you're not, you don't need to, let's say you got people in the family where some needs puree and some don't. You don't have to have a big processor like that. You could get a small one, just like this one here, right? And do the exact same thing. Okay, so now you just puree this. And I'll put this on the plate. And you'll get to see what this one is. Okay, so now. It's really fine, we're pureeing it, but a puree is thick, right? So again, if you want to thin this out, the same thing would apply with adding the liquid to it, okay? So I'm gonna put a little bit on this plate over here on the corner so you can see what that one looks like. And then I'm gonna take it, make it even looser or thinner, and put it on another plate. All right. Okay, so we got that. So now, again, if you want, this isn't open, so I'm gonna use this one, but you could easily use soy milk if you want to ramp up the calories, okay? So now, we're gonna take that, put it on, just like so. And so now you can easily just add some liquid to it, you can warm up the milk. And you can add as much liquid as while you're watching this. To gauge how thin or how thin you want this to be. Every once in a while, break the sides of the bowl, just like so. Okay, and then we'll do it again. Okay, so you can see just by adding some liquid to it. Okay, now boy, this thing is really loose already. I'll put some on a plate so you can see. So again, you can gauge to whatever it is you're looking for. Okay. Now, this one here, look and see how smooth it is, that's a puree. If you want to liquefy, you could add more liquid to that, or if you put it in a blender, it'll come out smooth, just like a smoothie would be. Okay, so you've got 3 different stages here. All right. So this would be puree, just like so. That's what the spoon is, what it's like normally out of the oven, and then what you see on the lip of this plate, that is a thicker puree that was just, you could do that almost with a knife or just put it in the processor. And so you got 3 different stages of this macaroni cheeseless mac. Okay, we're gonna put that over here. Put that over here. And now we'll go on and we'll do something that we're gonna do for dessert. All right. We're gonna do one more. We're gonna do a cookie. Okay. So the next one, oh, and also, just while, because you might be able to see this, hopefully you can. Maybe move this over, you might be able to see. Under my cutting board, I always have something wet. Because then your cutting board doesn't slide if you do that, okay? So you can see right here, this is a paper towel, because otherwise the cutting board's gonna slide, right? But by having something wet underneath, it keeps it from sliding. And you want it stationary, and that's a good thing to have and do. All right. We're gonna set it over there. Okay. So now we can do our cookie. All right. So our first one, these are oatmeal cookies. They're vegan. All right. So put that over there. Bring up questions. Okay. So here's what the cookie looks like. I'll bring it up closer. The way we're gonna make this. Okay, real easy. We got a banana again, so this is a half recipe. A full recipe would be 3 bananas. You want them ripe. I'm only using 1.5 for now. And then you could tell by looking at the skin, these were ripe bananas, not overly ripe, but you know, almost like ripe spot on like this. Okay. And then we're just gonna take a masher like so. And we're just gonna, so I got the whole bananas in the bowl. We're just gonna mash them with our masher, okay? Now, you could easily do this in a processor and liquefy it really quick. If you don't have a processor, or you got people that, you know, children again, and like to mash, this goes really quick. And I'm almost turning this into a puree right now, just in a short period of time. Okay, and I'll bring this up close so you can see. This is what we're looking at, just like this, okay? Right here. So just with that masher, that's what you get. See, look at it, it's all. See how it's dripping off right there, just like so? Yeah, okay, that's what we want. Mash the whole. Right? Now we add the rest of the stuff. Okay, so now we got some oil. So tablespoon of oil, this is extra virgin olive oil, it's 120 calories a tablespoon. That's more. We got some vanilla. Okay, we got some prunes. Okay, so that could help, you know, if there's constipation issues. We got some raisins. Now we got some toasted nuts. We got walnuts and pecans. We're mixing all that in with our banana. It's like a real loose batter now, just like so, see? And then we got whole oats, all right? So we put our oats in. Okay, that goes down there. Okay, and then now we're just gonna take our spatula, and we're just gonna mix in the bananas with our oatmeal, just like so. This is what I'm doing now. And now this is getting thicker and drier, just like that, okay? Okay, just like so, that's all we're doing. Okay, now when we're done, and you got a good thorough mix, which doesn't take long at all. Just like so. All you gotta do is you gotta get a baking sheet. You could use a silk pad or this is parchment paper. You just take a 1 ounce. Okay, like so. And then we take that scoop. Just like that, okay, and you put it on your parchment paper, just like so. That's all you gotta do. Until all your batter is done, just like that. And when it's all done, I mean, you bake these at 350 for 20 minutes, okay? So you just put them on your baking sheet like that, okay? And even if you wanna make them flatter, you could just take your fingers and just touch the top. Like I just did now, it just went like so. And that's all, you don't want it any more than that, that's what you would do, just like that. And when you're done, that's what you get, right? Here's our oatmeal cookie, just like that. It's delicious. It's vegan. There's no dairy. It's great. You know, that's what they look like when they're all baked. Okay, now, if you want to turn this into a texture modified version, well, you got a couple options. You can take this cookie as it is, okay? And you can mince it with a knife, or you can put it in a processor. Or let's say you really wanna be really careful, make sure that it is smooth as possible for you. So we created another recipe for a texture modified oatmeal cookie. And here's what the difference was in that one, okay? So when we go to do this one here, we take it, and I'll bring this up to you. We chopped up the nuts in a processor and the banana, and it comes out, look at that, there's nothing at all that's really chunky in there, okay? So basically, we just take, I'm gonna use our smaller processor here. So you can see. Okay, so we take our, we're gonna do our oats first. Okay, so instead of folding the oats in, right? Instead of folding the oats in. Okay, we're just gonna already make an oat flour. Okay. I'm gonna do this about 20 seconds. Okay, so now I have what amounts to, looks just like an oat flour. So if I pour it in here, see, it comes out, this is really fine chop, and it chops really fine because it's, you know, it's dry. Okay, so now we're gonna put this back. Right, and now we're gonna do the same thing with the nuts. Okay, so the nuts go in, because this way I'll get it finer than if it was wet. Okay, so the nuts. Right. And same thing with the nuts, look at that. Very nice and fine, okay? So if you really, if chewing and swallowing is an issue, we can make this cookie in multiple ways. Now, here's another step. The recipe has raisins and prunes that we rehydrated, and we put that in with the cookie batter. I gotta take a banana and do a banana as well, so I'll do that. And while the banana's doing, I'll explain an option to doing the raisins and prunes. So we can take the raisins and prunes, rehydrate them. Okay. Or instead of doing that, an even easier way is we've done recipes for a raisin reduction. A raisin reduction is just raisins and water equal parts, put them in a pot, 15 minutes, cover pot, reduce it down, it comes out just like baby food. I'll show you here on the spoon. And then you could use this as a sugar in many applications. So an even easier way to make this cookie, instead of, you could just eliminate that whole step of rehydrating prunes or raisins and then just use raisin reduction. Okay, so that's an option for you as well. But if you want a little more texture to it, you'll get that by doing this. So it depends how smooth you want it, or if you do want some texture in your cookie. All right. So now you can cook that banana, and boy, I got banana nectar here. It's fully liquid. Okay, and so to that, I'm gonna add my vanilla. Okay, like so. And then I got a little bit of oil that's gonna go in. Okay. And then I'm gonna take some raisin reduction. Okay, to just show you how easy this would be to do. Okay, so we're gonna put a little bit of raisin reduction because it's already pureed. Okay, or I would just take those raisins and prunes and puree it like this. Okay, so it's optional to you, but this would be a faster way. We're gonna mix that in, just like so. Now when it's done, okay, we're gonna set this aside. We take our bowl, like so. We take our wet out, just like that. Right? And we're gonna pour this out of here. Okay, and you'll see, look how it pours out, look at it. See how loose it is? Just like so. That's pureed already, so that was the bananas and vanilla and oil. And then now, here's our nuts and our oats. So you can see the difference already between what this one is like and the original way. So if you really want to have a cookie that has the least amount of, chunk like or coarse texture, this is what you got. It's smooth. Now, we're gonna do the exact same thing as we did with the other cookie. Okay, we'll put these over here. So you can use the exact same scoop, same deal, right? And then we're gonna take that, and we're gonna take it, and you just put it on a tray like so. That's your cookie. Okay, you don't even really need to press this one down, but you could. And that's what it looks like, and this is what it looks like after it's baked. Okay, so here's our two cookies. All right, this is the raw one over here of the chunky. That's the raw, the pureed when they're baked. That's the chunky. This is the pureed. Okay, now let's say you want to take that and liquefy that. Okay, you could use some banana like I already got in here. Okay, and then you just take this cookie, you could break it up, put it in here like so. Okay, and then take it and just go ahead and puree it. And you can add milk if you want to. You could add more banana if you want to. Okay, so I'll get another chunk of banana, just I've got some over here, and you'll see, right? So again, you could add, I got a chunk right here. So you could add milk, or you could add banana, or even juice if you wanted. I'm just gonna put that one chunk in like so, and you'll see how this goes. And there we go, here's our puree. So I'm gonna get a spoon and I'll put some of this on this plate. And I'll bring it up. And you'll see what all three look like. Okay, so this one was already baked off. But here you go. And again, if you want this even liquefied for that stage, you just put it in a blender with more liquid. So here's our three: regular, baked, texture modified, baked, or you could take that, mince and chop it, and here it is, pureed, and where it's really soft. And again, you can make this different degrees or stages of thickness by adding liquid. Okay, so those are our 4 recipes. I think I got a couple minutes. I wanted to give everybody a holiday gift. So I'm gonna try to do this for Thanksgiving or the holiday for you guys, okay? And it's a napkin bowl that you could use for your holiday table, all right? So I'll show you real fast. And you got the instructions. I think they're gonna make this available for you. Because I know just watching me right now, not be the easiest thing to catch it. But here's how you do it, all right? So, whole napkin, we're gonna fold it like a paper airplane. The open end is to us, okay, to you. Take it, fold it once, fold it again, just like so. Okay, like making a paper airplane. Put your finger in the middle and fold the right side down and then the left side down. When you're done, it'll look like a little house, right? Now, just like making a paper airplane, now we're gonna do that one more time. Fold this in again, each side one more time. Okay, now it's like an arrowhead, right? We're gonna close that, turn it upside down, lift the top flat up, the bottom flat, we're gonna fold in, and there you go. Here's our elf shoe napkin fold. I'll bring it up, put it on a plate for you so you can see. Okay. And all you gotta do if you want a healthy candy cane to put inside the center, you could take that same cookie batter that we did for the texture modified diet, shape it like a candy cane, bake it, maybe a little less time, and then let it cool, and you'll have a healthy candy cane to put in. I think I'm at time. If you got any questions, you can put it in the chat. And Lisa, you're good to introduce Dr. Almeida.
Yeah. All right, Dr. Umeda, you're up next.
Okay. Thank you. Give me 1 second. Okay. So, hello, nice to meet you, everyone. My name is Dr. Umeda from the one of the doctor from the wellness department. Let me share the slides. Give me 1 second. I assume you can see the slides here, and now I switch to full screen. Can you see as a full screen?
Yes, we can see them.
Yes, great, great. So we have some program which is called Integrative Medicine or Integrative Oncology. Maybe some of you have heard of holistic medicine or integrative medicine, but our department, it's also called Wellness Department. So our department is different from the Cancer Institute. But yes, the Chef Perko, Jim Perko, we have several providers in our department, not like doctors myself, but also we have, as you can see on the right top corner, nutrition counseling and yoga practitioners, meditation, which we call it mind-body psychotherapy, and also hands-on therapy such as chiropractic treatment providers and also massage therapists, and also acupuncture, which is to use the needles. Maybe you have heard of the acupuncture using a very thin needle like you're here, but putting the needle onto your body surface, it may help to relieve several symptoms. So simply speaking, we do everything natural medicine, natural therapy to support you during your treatment, such as chemotherapy or hormone therapy, immunotherapy, radiation, surgery, and after the treatment. So we call it's an integrated medicine or holistic support. Holistic means we try to see as a whole, like a big picture, whole person approach. That's we are embodying the philosophy of our approach, holistic medicine. Integrative medicine means we're trying to blend the like a conventional treatment, like a cancer treatment, and also something natural, how to blend together, integrating together. So there are several ways to we call it, but basically, simply speaking, we try to do natural things. So what is the integrative medicine for cancer? On the left top corner, it's a patient-centered and evidence-informed field of the comprehensive cancer care that uses lifestyle modifications, mind-body practices, and also natural products or natural therapy when appropriate, alongside a conventional cancer treatment. So some people might have the misunderstanding, like they call it alternative medicine. This is not doing the chemotherapy and doing the natural therapy only, and we are totally against that way. We don't do the alternative medicine. Our approach is we just support you during your cancer treatment and after. So we have a program, and also the very same program, the major cancer hospitals such as MD Anderson in Houston, Texas, they have that. Memorial Sloan Kettering in New York, Dana-Farber in Boston, and also Cancer Treatment Center of America, they have the same program. Yes, they have physicians, yoga practitioners, yes, massage therapy, acupuncturists, and also nutritionists like that. If you see on the left down corner, the growing evidence. So we as physicians and researchers, we believe the evidence, the data based practices. How can we make a recommendation depending on the condition? Yeah, there are multiple research data for these. Even this is for the natural medicine, natural therapy. So for example, if you see the pain area, for example, acupuncture, massage therapy, meditation have been researched a lot. So they are considered to be good to try. Chronic fatigue, exercise, yoga, acupuncture are recommended. If you see down here, neuropathy, the numbness, tingling in your hands or feet, mostly triggered by the chemotherapy, some chemotherapy drug, not all of the chemo drugs. But acupuncture may help, massage therapy may help. So depending on the condition, we made a recommendation. How about try this? How about try this? Depending on the condition. But always we make a decision or recommendation based on the statistical data. So I wanted to share some quick overview of this, our approach. And also with this, we are collaborating. For example, this program, this culinary medicine, Taosi culinary medicine, the chef Jim Perko, and also the Cancer Support Center at the Taosi with a beautiful collaborations. This is one of the example. And also we have one of the acupuncturists. Her name is Kim Nguyen. She just joined, she started the practicing the acupuncture at the Taoiseach Center, not every day, just 1 month ago. It's just a kind of pilot trial, only for 1 day or 2 days a week. And this is really kind of random, and this is all funded by the philanthropy. So we just started as a really kind of experimental way, but we believe there are some people, we wanted some people to receive the acupuncture and feel like, oh, what is like the acupuncture? So people who are receiving a chemotherapy infusion center, yes, if the Kim is there, she can practice the acupuncture. So actually, you cannot make a reservation for this. This is first come, first serve like this. And so there are limitations. It could be 3 hours or 4 hours. So really random. But if you see the Kim Nguyen at the cancer center, especially if today is your chemotherapy day, and you receive the chemotherapy IV therapy, and you may see her and you can just talk to her, and if she's available, you can receive that acupuncture. So what I wanted to tell you is we're just trying to expand our collaboration with this teaching kitchen culinary medicine and also acupuncture. And also I myself started seeing the cancer patient at the Taoiseach just only once a month. But not every Monday, but first week of the Monday every month. Yes, only in the morning. I joined the Taoic Center. This is the palliative medicine department. This is located in the second floor. So if you're interested, make an appointment. But also I see other day on the every morning, I see, let's see, on the left, right down corner, the location, main campus, so Taoic Cancer Institute, second floor. That's only once a month. But also every Monday, I practice at the Glickman building, which is also called Q building, AM and a PM. And I see cancer patients, but also non-cancer patients as well. For example, people with a headache or migraine or digestion problem, anxiety, depression, joint pain issue, really variety of symptoms, variety of disease we see to provide the holistic or integrative medicine approach. And also I have a clinic at the Willoughby Hills, and also I do the virtual visit. So if you're interested in this phone number, 216-448-4325, and just call. You can make an appointment. You don't need a referral. If there's a referral from your oncologist or surgeon or radiation oncologist or palliative medicine doctor, that's great, but that's not always necessary. So if you have an interesting or question, just let us know. And also, actually, I have the joint appointment at the palliative medicine at the Taoic Cancer Center. So again, we're trying to expand our collaboration, make it more. Yes. So yes, so that's I wanted to share with you kind of our department introduction. So I will stop sharing here. And if you had any questions, happy to take any questions.
Don't see any questions in the chat.
Sure. And I just put our department email address in the chat, cilm@ccf.org. If you have a question, just email us, or let me just put the phone number, 216-448-4325. Our department is called Wellness and Preventive Medicine. Yes, but if you have a certain question, let us know anytime.
Thank you, Dr. Umeda.
Thank you.
All right. Are there any other questions? Jim, there's a question for you. Does the olive oil get too hot to be healthful in baking cookies? Jim, you're on mute.
Sorry, Lisa, thanks for
Yeah.
that. Yeah, so these cookies, see how small they are right here? Okay, so they're only in the oven, for like no more than 18 minutes. You can minimize that by making them even smaller. But it raises a good question, because any kind of oil, no matter what kind of oil, and it should be stored in a cool, dark place, preferably in a can, away from heat, light, and air. In terms of cooking with it, we don't ever want to fry anything. It's always healthier to cook at lower temperatures. And in the case of this cookie, at 350 degrees, it's not at 4 1/4 or 450 or 475. You can even do this cookie at a lower temperature, like 325 degrees if you want for a lower period of time. But it's only a small amount of oil in a small cookie for a short period of time. And it's not at a relatively high temperature. So any, risk factors associated with high temp cooking and oil, you're really not having that in this cookie. I think Lisa could chime in on this one. If we want to get you protein and calories and healthy ingredients, this cookie is better than probably a sugar cookie or, the spike butter cookie, or things like that are loaded with, manufactured ingredients, processed ingredients, and a lot of added sugar and sodium. So,
Yeah.
do you want to add anything to that, Lisa?
No, I think you answered that well. And, when it comes to olive oil or any kind of oil, it's going to add additional calories. So if you need to be, you know, um, adding extra calories into your diet to help maintain your weight or gain weight, that's one of the things we recommend.
And I guess I would also add, you can make that. There's cookies you can make with no oil. So we do a great chocolate chunk cookie where it's got walnuts in, if you're looking, we did this one because it was for a texture modified diet. And that was one of the ingredients of the oil because it was selected to do for the purposes that it's easy to puree and swallow, can even be liquefied. We do a cookie that's a chocolate chunk cookie that is had the oats brown just like the flour. Then we have toasted pecans and walnuts, and then raisin reduction, vanilla, and cinnamon. And then we just fold the chunks of chocolate. That's only baked for 13 minutes. There is no added oil other than what was in the walnut or the cashew. It's a great cookie. You can do the same thing with that cookie. Chop it up, mince it, or even puree it by adding soy milk or liquid to that as well. And then, we would always tell people in our culinary medicine programming, right? Always think about the things you can have, should have, or advised to have. And when you do that, you'd be surprised what you could come up with. And so we got recipes for great cookies that are vegan with no oil that you could also ramp up the calories because nuts are caloric. And there's ways that we can even puree that as well. So there's always options.
Yep. Does anyone have any other questions? Is there a database where we can find the Cleveland Clinic recipes?
So there's recipes all over that the Cleveland Clinic does specific to the ones we do in culinary medicine. We created a nutrition and culinary medicine toolkit that might be available, I believe, on the internet. Also, by going to arthritisfoundation.org Cleveland Clinic recipes, you can download an ebook of 23 recipes to fight inflammation that are mostly plant-based, low in added sodium, sugar, and fat. And also for even more, I partnered with Dr. Michael Roizen, who was the first chair of the Wellness Institute for Cleveland Clinic. We created 113 episodes of In the Kitchen with Chef Jim and Dr. Mike, where I show a recipe just like I did today. And you also have Dr. Roizen giving the science about the helpful and beneficial points in the recipe. And then we show you how to make the recipe according to the points Dr. Roizen talks about. That's In the Kitchen with Chef Jim and Dr. Mike. That's free to the public. And that ebook is also open to the public that you could download. And we have a toolkit that I believe you could just Google Cleveland Clinic Culinary Medicine Toolkit. And there should be some in there.
All right. I think we are out of time.
Oh, I just added the link to the chat that
Thanks,
Jim
Doc.
just mentioned.
Thank you.